Since 2009, all states in the U.S. have been officially designated as class-free for bovine brucellosis. With the exception of the Designated Surveillance Area, or DSA, in the greater Yellowstone area in parts of Wyoming, Idaho, and Montana, the U.S. is currently designated as brucellosis-free. So why worry about brucellosis vaccination of heifers? Brucellosis is a contagious disease of cattle and other ruminant animals that can also affect humans. Its main threat is to cattle, bison, and swine. The disease in cattle is also known as Bang's disease. In humans, it's known as undulant fever because of the intermittent fever it causes. In cattle, brucellosis can cause abortion, stillborn or weak calves, retained placentas, and decreased milk production. The disease in cattle is caused by the bacterium Brucella abortus. Brucellosis is a zoonotic disease, meaning it can be spread from animals to people. But eradication efforts, along with modern sanitary practices and pasteurization of milk products, have greatly decreased the frequency of human infections. Superior livestock lots officially vaccinated for brucellosis are recognized in sale catalogs. The status of tattoo legibility and percentage of the lot vaccinated are also denoted. States generally have an age requirement between 4 and 12 months of age, in heifers only, for brucellosis vaccination. However, always rely on your local accredited veterinarian to keep current on your individual state's animal health regulations. Heifers must be vaccinated by a licensed veterinarian. The RB51 brucellosis vaccine is a live virus vaccine and is administered only one time in the life of the animal. Mandatory identification of official vaccinates includes an orange tag in the right ear and a legible tattoo in the right ear. RFID tag identification instead of the orange tag is permitted in some states. There are several reasons why it is a good idea to continue vaccinating replacement heifers for brucellosis. Number 1, continuing efforts to prevent disease reintroduction. Vaccination of replacement heifers is a herd immunization tool that could help decrease the risk of reintroduction of brucellosis to your herd. Number 2, access to more markets. Brucellosis vaccination may be required for some special female sales and is sometimes a prerequisite by buyers. Number 3, permanent ID. Official brucellosis vaccination tags generally meet individual ID requirements for cattle movement and prevent the need for additional ID for interstate movement. Number 4, standard of care. In many areas, brucellosis vaccination has been a standard of care for well-managed replacement females. Even with easing brucellosis regulations, the orange tag is widely recognized. Number 5, secondary identification. By cross-referencing the Bang's tag with a more readily visible bangle tag, individual identification can be maintained for the life of the cow, even with tag loss. Recently, Superior Livestock has begun increasing efforts to market replacement females to meet the demand for high-quality replacement cattle with known genetics and an established health program. The first Superior Select replacement female sale was held on October 24. Plans are to hold several Superior Select sales in 2014 and beyond. In these sales, all weaned heifer calves will be required to be brucellosis vaccinated and properly identified prior to shipment. Open yearling heifers consigned to the sale must also be brucellosis vaccinated prior to consignment, since they would be too old to be vaccinated between sale and shipment. Officially vaccinating potential replacement heifers for brucellosis assures access to more markets, including Superior Select replacement female sales. Always consult your veterinarian with regard to current regulations about brucellosis vaccination and movement requirements.